Can you turn off the... Hi! Hello! I think we're live. I think we're having a problem with the video again. The delay of the video versus the audio, and I don't know how to fix that actually. Let's see. If you're there, let me know if you can see me. Hi! This, we didn't have this problem before ever. I have a feeling it might be an issue with our connection, so I apologize for that. It has been raining non-stop over here, so I wonder if part of that is the... Good morning from Valenzuela. It's Leah. Hi. How are you? Let's see. Okay. Okay. I'm waiting for... Yes, jumpy video. That's what I'm noticing too. And dogs. Hi, Jello. Hi, Jenna. I hope you got my answer to the DM. And if that's helpful. If not, let me know. I'll get more info. So I hope, yeah, we're dealing with the jumpy video. I don't quite know how to fix that. I have a feeling it's our connection. It has been non-stop raining here. I think there are 2 storms, if I'm not mistaken. So let me know if the jumpy video becomes a real issue. And I don't know, maybe we can stop and restart or something. You can see. Oh, Leah, I'm happy. Good. We actually got some questions already, so that'll be cool. Hi, Anna. That's kind. Thank you. It's to offset the palpitations. Hi, Nina. Bulacan. I don't know how the flooding is over there. Oh, good. Okay, so the video is jumpy for some of us, I guess, here. I suspect it's a connection issue. I do think it might be because of the storms here. So I'm glad if it's working for other people. Yay. Okay, well, maybe another 40 seconds or so and I'll start. There really isn't much for me to intro today. Hi, Jean. All from Laguna. Cool. So, yeah, there's not much for me to jumpstart today because basically you guys are going to take the reins and decide where the conversation goes. Oh, how funny. If we just... You're seeing the dogs in the background. My daughter's exercising the dogs. So if you hear barking... Hi, Hannah. Yes, I'm excited too. You and Leah are excited. Okay, game. So I'll get started so we can get as many questions as we can get in today. Thank you for joining us for our Skinsights on basically whatever you want them on. For those of you in the Philippines, or at least in the Manila area, we are dealing with lots of storms, so just a quick reminder please on safety. Sort of wading in waters and floods and stuff like that. Just remember to disinfect even more, boo boo bomb, all these things. If you notice a cut that is not healing or getting really tender, or a lesion that's getting really big, don't dismiss it. Maybe go to urgent care or emergency care. Hi, Tammy. Morning. Oh, good evening for you in Maryland. But yeah, so people, please be safe, if you're walking around in floods and stuff. But yeah, otherwise today is really about you and your questions. Don't forget to like us on Facebook, follow us on Instagram, and subscribe to our YouTube channel. We're really getting pretty good about getting new content up there all the time. And I'm in the middle of 2 InSkin articles too, so hopefully we'll have more of those up soon. Anything that's VMV related, if you ask me after my mom comes on, I will get to that after I think she leaves, so that we really concentrate on the more medical stuff with her. You can shop all of our products, as you know, internationally at vmvhypoallergenics.com, where our main focus is really getting stocks back in. So, yeah, I mean, we're working on that. We have some air shipments going over. Or VMV Hypoallergenics in the Philippines, where you can also find us at the clinic or on Viber. And we've got some cool things happening, like at home patch test kits. And we can also help you if you want to get my mom's book, RX Coconuts. And if you would like a teleconsultation, actually we're open. The clinic is open. And my mom is even going to go. She's so excited. She gets to go and she's like, I'm so psyched. And people ask to take pictures with me. And I'm like, okay, just yay. But she's being very careful. But she is going into clinic physically. So if you would like a consultation or teleconsultation with her or other doctors or nutritionists we work with, PM us and we can help make that happen. Otherwise, yeah, make sure you're signed up for our emails and stuff, because that's where we announce fastest what is in stock, what has come back in stock. And really, I have nothing else to add, because this is all about you and your questions. I will call in my mother, who's our founding dermatopathologist, who's this big, big brain, and she's generously giving me her time. Have a seat.
Can I move this?
No.
I have to stay here.
Yes.
Alrighty. Hold
you
on.
get up?
Hold on. I can get up.
Yes, all good?
Yes, all good.
Okay. Are you comfortable?
Hi. Yes, I'm very comfortable. Thank you.
Awesome. So, y'all know my mom at this point. Very, very big brain. Something to just reiterate, I think, is that not a lot of dermatologists are also dermatopathologists, and she is both. And being a pathologist, she has a deeper understanding of the skin, and she's the one who looks at biopsies and stuff like that. So she's actually, I think, a really unique perspective to get for questions we might think are too basic or whatever, right? So I am excited, folks. I will start and make sure. Do you want to say hi?
Hello, everybody, wherever you are, and hope you're all keeping safe.
Okay. Our first question actually came with the announcement of the event. So we'll start with her, who is Milia. Taga Cebu ba?
Taga-sugbog yun ka.
Okay, so maayong buntag. That's correct, right? That's morning. Yeah. So I used to have fairly clear skin, only getting pimples when I'm near my period, but my sister-in-law made me use a brand. After 2 weeks of happily using it, I started getting pimples in my cheeks, which is not common, and I also felt that my face got sensitive, like I have a sunburn. I told my sister-in-law about the problem, and she told me it's normal if the skin is still virgin. I'm going to let that sink in for a bit. And she said that her skin is just purging. So it's been 3 months since her first use. Hi, Madison.
Hi.
It's my daughter, Madison. So it's been 3 months since her first
How about
use.
me?
Hello.
So it's been 3 months since her first use, and it's not going away. So my sister-in-law had me try different products from this brand, even the ones specifically for sensitive skin. I don't know what's going on. I hardly look at the mirror anymore because it's frustrating to see myself. Ouch. So first, Mania, I'm sorry. I've been there where it's hard to look at yourself in the mirror. So let's try to make that a separate thing and know that this is just your skin. Anything physical about you is not the most interesting thing about you. So it's frustrating, and I get that really, really personally, but don't worry, there's help. This is not an impossible thing. So, what do you have to say about purging and virgin skin and stuff?
Okay. Mania, I presume you're above 25 years old, right? Much more, maybe. Okay. You have what we call adult acne, which accounts for as many, even sometimes more, than adolescent acne. Now, adolescent acne, we know the cause, right? It's due to the hormones that are surging in your body as you become a young lady, or a
A young adult.
young adult. Okay, and but when we deal with adult acne, it's always good to consider all the possibilities, because sometimes you're blaming the product that you are, or rather, you suspect the product that was given to you, that you started, as being the cause of these irritations that you're having. But, so that's one possibility. That we're going diagnosis. That's one of the suspect causes. Another, though, is that it could be coincidental. You may have been using something else over the past 2-3 weeks, and at the same time, that and not the 2-week course of this new product was the one that caused the irritation. Or the combination of these old products you've been using and this started to use it. Or you may be at the time of your life that certain skin eruptions are coming out either because of an external problem like rosacea, which begins to manifest at about 35 and onwards, and you don't get it when you're younger. And one of the problems with rosacea is that you become irritable, your face rather,
Yeah.
your skin no longer is virginal, it's irritable.
Okay, I'm going to
Develops
tackle that
acne.
virgin thing later, but okay.
And that's rosacea, that's external. It could be the chemicals in the air that I keep talking about that can be the cause of these irritations. And lastly, it could be that you have internal problems that are developing,
Okay.
giving you the
So,
acne.
I think-
So it needs a little bit more perspective
Yeah.
and not just, on
It's
the
this
one.
product, yeah.
Yes.
I don't think that it's beyond. I think she mentioned it earlier. It's not that the products are not the problem, but there could be other things at play too.
Correct.
So in cases like this, obviously I would definitely say see a dermatologist because you want to make sure your entire history is taken to rule out any new medical things that might be happening. But if you would also like immediately to do something, I would definitely say something standard that we do that actually came from her. Stop the products that you're using completely
Go on a fast.
and go on a 7-day skin fast. During that time, you would use only really pure organic virgin coconut oil to cleanse your face and really nothing else. So you would stay out of the sun so you don't use a sunscreen. You might use a very, very gentle shampoo and conditioner. That's it. Don't use anything else. So you give your skin time to recover from all of it, right? Any kind of influence that might be from the products to any kind of inflammation, any kind of reaction. We have a nice blog post actually that gives you a step-by-step on how to do a 7-day skin fast. And if you do a 7-day skin fast and then you see your dermatologist, they'll be happy anyway because they would have told you to do the same thing.
Right.
Right? So I would start with that. On the issue of virgin skin, I honestly don't know what that is except maybe like at birth. But even babies get, what's it called?
Not
Cradle
necessarily
cap.
virginal. Yeah.
Yeah, my son had acne at birth from
That's
my
right.
hormones.
That's right.
So I don't know
From
what
the
virginal
hormones of the
skin
mother
is.
passing on to the baby.
Exactly. And on the idea of purging, because someone else also asked, by the way, lots of familiar faces here. We have Leah, Jean, Tammy from Maryland, who we've been helping with the rosacea
Yes.
question.
I'm so impressed with you, by the way, Tammy. I'm really impressed.
Seriously. And then Jean, I mentioned Jana from Utah is here, who I gave the bandages that you recommended to. But I know someone else was, oops, no, sorry, it's asking me something I don't want to. Asking about purging. Here we go. Leah was asking, what is purging? Why does it happen? Aside from retinoids, what else can cause it? What to do to address it?
Okay. The products that are used for skincare nowadays are, can be quite an irritant. I'll tell you what, for instance, in the old days, you were using mild cleansers and moisturizers, and skincare was basically a simple product that had no really active ingredients. In current times, cosmetics are now allowed to make claims. The claims that they make that then gets approved by the FDA in whatever country you're living in and using that particular product, that efficacy, what we call efficacy and safety studies, as long as it has efficacy and safety studies, the active ingredient can be present in a cosmetic and skincare product. So the retinoids at a certain percentage is allowed. And retinoids are basically acidic. At least the gold
She's
standard is
asking,
called
aside
retinoid.
from retinoids, what else can
Oh.
cause purging? What is purging and what to do about it?
What is purging by her definition?
So, okay, when we've used it in the past, or I think
I mean,
the way
if
other
you mean
people,
fasting, then...
no,
Oh, no?
no. But how I know that some people use purging when it comes to skin is when you're using active ingredients for the very first time. You might like salicylic acid is classic.
Right.
To me, that's what I think of when I think purging.
Purging.
It's when you use salicylic acid. Salicylic acid is quite unique. more correctly, is unique in that it's a beta hydroxy acid. It's oil soluble, so it goes to the skin's oiliest areas the most, and that's where it micro exfoliates. So the first time you use it, some of that gunk will come up. Gunk, pore cloggers, because your pores aren't necessarily used to
I
being
see.
deep cleaned at that way. So there's a purging, there's an initial acne breakout because there's stuff coming up, right, to be expunged. That's for salicylic acid. That's the classic thing. For other things, I don't know. I know that people tend to toss around toxic and detoxing and purging very easily, but there's no real basis for that in skin. When we talked about this once. When it comes to detoxifying, it's a very particular medical term, right?
Purging is not a medical term, I don't think.
Purging is not a medical term. So if someone is trying to say detox, that's a medical term that has to do with the ingestion of a poison. And you detox very specifically
Right.
with charcoal
Correct.
or something. So that's not quite the same thing. So I guess, Leah, the short answer would be to try to find out what they mean by purging, because it isn't a standardized regulatory term, and it's definitely not a medical term.
Right. But I can understand where you're coming from when you mention the word purging, and that is really, like I was saying, the skincare products nowadays, many of them are allowed to put in active ingredients that needs purging because they are in fact irritants at the very beginning of your using them. They're not allergens, they just irritate the skin because they're acidic. Any more that you go like that when you're eating something acidic or spicy or whatever, you're not allergic. You're just reacting to its immediate effect
Right.
on the mucosa. So, yes.
Yeah, and something pala I wanted to mention for Mania earlier, who asked about the reactions to this product. If you are feeling a stinging that's really painful, it could be the treatment itself, and that could be a temporary irritation, but after 3 months, there might be an irritation or an
Right.
allergic reaction already.
Right.
And that could be contributing to the inflammation of the acne.
What I often tell patients when I prescribe to them a product that has an acid like azelaic acid or retinoic acid or any of the other acids is I tell them that's an irritant, by the way. And so the first time you apply that, it should be about once every 2 weeks or once every week. Then you can move it on to one every other day at night only until you can use it nightly and then twice a day. And that can take anywhere from 2 to 3 to 4 months. But you have to do it quite slowly with these active, depending upon the sensitivity
Yeah.
of your skin.
But that's also why it's so important you don't use any other allergens or irritants while you're using actives, because they can be like that. Are you comfortable? She has a little bit of a pain. Are you
I'm okay. Thank you so much for your concern, darling. Thank you.
Sure. All right, Jean is asking, what are some things to remember for dry skin? How to manage it effectively?
Okay, for me, any product that has a perfume, a fragrance, a preservative, and just about everything has preservative. But at least, if you look at the ingredients list and you see preservatives that are anywhere from 2 to 3 to 4, I mean, you're really courting trouble with those. So, products that have no fragrance, no preservatives would be ideal. And sunscreen ingredients sometimes are added to skincare and cosmetics. Again, the ingredient has to be looked at carefully and be sure you're not allergic to that particular ingredient.
I really find, especially for dry skin tends to be, what am I trying to say? A lot of sensitive skin or skin that is dry. So many skin conditions that are mistaken for just dry skin could actually already be atopic.
Right. Dry skin can actually mean barrier
Defect
the
already.
barrier defect. In other words, there has been a chronic irritation of the skin,
Yeah.
so that eventually it just becomes dry and drier, and that can be an irritant effect to something that you're using.
Right. So when she talks about no irritants, no allergens, it's to help manage the dry skin if in fact it's not just dry, if it might already be a contact dermatitis or an atopic dermatitis or a mild, I don't know, psoriasis or something, just to rule that out and make sure that's taken care of. Dry skin also means the barrier is not so great or is
right.
already, suffering. So
dysfunctional already, to
Stressing
use
it
a current
more
word.
is not a good idea. So number one is avoidance. Actually, prevention is power, especially in dry skin. And then I wouldn't use a toner, for example. I would choose a moisturizer that is also, you keep saying it, humectant,
Occlusive.
occlusive, and moisturizer. Want in a
And contributes to
moisturizer.
barrier repair.
And contributes to barrier repair. We have a live stream on the care for dry skin. Her favorite is obviously coconut oil. For very dry skin, she likes layering. So she might say do a moisturizer with coconut oil, then a petrolatum.
Oh,
on
fantastic. Do that for a couple of nights and you'll be happy.
top. Okay. And then Jean also is asking about falling hair. We also have a live stream on hair and thinning hair. But there's a lot you can do for it now.
Yeah, there are lots of things you can do now for thinning hair in both men and women. The other day I had a man who came back from after I hadn't seen him for a whole year, and I was wondering why he was gone. He said, because it's been working. We have this new product of a little bit higher the concentrations, and I tell you, he had such a thick head of hair. I plan to call him up later to give me a picture of his before and after, so I can brag about it to Laura.
So
And considering, so those are from topicals to actual surgery that are really very effective. You know, topicals meaning what I just mentioned you of chemicals, ingredients that have now been shown to really affect the hair growth. And then there are also, by the way, hair thinning can be just due to telogen effluvium, which means it's just, or temporary. We
You're
have that
stressed
live stream on
or-
that one,
yeah,
just
or
due
we're
to
sick.
stress. Right.
So yeah, so I think
And then going on from there are semi-interventional where we get your own blood and get the platelet-rich factors from the platelet form and then inject it into your skin, into your hair. And then there's another one where we get biopsies from the back,
there's
melt
a
it
lot.
down and inject it. And then lastly, there's the hair transfer. All of them work beautifully.
So going from maybe the most extreme, if I heard her correctly, and to summarize for folks, you have procedures that are actually quite effective, many kinds. So you'd have to talk to your dermatologist about that. You have topical actives, drugs that you would apply topically that are also very effective. Isn't there also a pill? There's a medication that you can take.
Yeah, as a matter of fact, that topical called finasteride,
Finasteride.
you can
It comes
take
in a
with
pill.
the pill. I mean, if you're a man, you take the oral and you apply. And I tell you, this patient who came to me the other day, was just the thick head of hair. Said, "Oh my God."
Okay, so there's that. And then moving earlier, there are things you can do to manage it if you're just concerned. She mentioned one is telogen effluvium, which is that's why your hair falls when you have chemotherapy or when you get pregnant or when you have COVID.
Or you get
Because-
typhoid fever or
Yeah,
flu that's
something
severe, or
that's
dengue.
yeah, so it's like a severe toll on the body, a severe stress that happens. And then when it's done, your hairs start growing again. It's a temporary thing. For things like that, obviously, try to not get sick. If you do, just concentrate, really, really concentrate on stress management. In general, stress management is so important to help prevent falling hair and baldness. And anything that can stress the scalp and the follicles.
That's
so
right.
again, you want to avoid irritants and allergens and things like that. I believe I might have skipped over Tammy. I'm sorry. Can VCO be used as an earwax softener?
Yes. As a matter of fact, it's one of the things that we're going to be having a blended learning activity in 3 hospital centers that hopefully very soon we will be going to start on critical, severe to critical COVID cases in hospitals and how to take care of mouth, tongue, throat, nose, because those are the areas where the COVID organism will be able to quickly multiply because these cells with glands have receptors for them. So anyway, part of that treatment is the ears as well, and we have given them, we teach them to use it inside the ear. You get a Q-tip. I mean, you have to be used to this, or just a little bit at the edge, let it go down gently. And if you do that twice a day, slowly some of that
Softens.
oil will go in and soften the earwax that
Tammy,
you may
I'm in the
have.
middle of writing an InSkin blog post about care for people, say the elderly, people who use medical devices or have to be in a bed for a while, and she talks about that there. So I will be going into that in detail. But also, thank you for liking my eyeshadow and my brows today. I made an effort.
Yeah, that's nice.
Thank you. A little bit of time. So Tammy has a follow-up. Can the skin barrier be compromised by well water that has become too low in pH for about 12 to 18 months?
Wow.
It was slow in happening, so we didn't realize it until husband and daughter had seborrheic dermatitis on the scalp. She and her daughter were having oily hair a day after shampooing, and she used to be able to go 5 days without washing hair. And if so, how long does the skin barrier take to repair itself?
Okay. With acids, they are good and bad to the skin. They can be good, they can be bad. And the goodness is the fact that the normal pH of our skin is actually 5.5. Ranges from 5 to 6.
It's slightly more
So
acidic
it's
than
slightly acidic. And it's because at that pH, the enzymes, the things that we have in the skin to combat the organisms that are pathogens that get in, are quickly snuffed by our own cells. But if you go more than that and start to go into the 3.5 down to 2, then you're in trouble because that can be an irritant. And like you said, the barrier can be compromised. It can peel off because that's a peeler actually.
That's how a lot of the alpha hydroxys work,
Right,
actually.
right. The alpha hydroxy acid is the one that when you go and have a peel, they're probably acidic solutions with either glycolic or strong mandelic or whatever acid.
So, sorry. So
Including
how,
salicylic acid.
How long then would it take for the skin to repair itself?
The repair of the
barrier.
skin of the barrier, if the entire thing has been stripped off, is up to 35 to 40 days. But if obviously not, so therefore it may take about, I tell you what, try putting on the coconut oil because the coconut oil is a pH that's 7. It's a neutral pH. And if you now place the coconut oil, if it's irritated, if it's warm, if it's itchy, if it's red, put that coconut oil in the refrigerator to make it like a slightly solid white butter.
Butter.
Apply it on your skin, get a cold towel also and put it on your face. And the effect is immediate because it then forms a secondary barrier while the barrier begins to heal itself. So time-wise, the time is much shorter. Like even 2 weeks, you will have a much better feeling about the barrier layer. It will, however, take a much longer time. And so to completely recover it, so that you will need to continue taking care of it properly with minimal application of things that are possibly irritants to it, including the acidic cosmetic and skincare products. They're highly acidic.
There you go. So a lot of the stuff, interestingly enough, that you would do for rosacea, that barrier repair, the humectant, then the virgin coconut oil, then an occlusive.
So it is a humectant. What that means is that it brings water by itself into the skin. Why is that? Because the coconut oil is made of triglycerides, meaning there is glycerin, glycolic acid, to which 3 fatty acids are attached. That when that is broken down, when the triglyceride is broken down by our microbes in the skin, what happens then is 3 fatty acids and the glycerol molecule, which is a very humectant chemical. It absorbs water. So it absorbs water from the air, absorbs water from down. You drink lots of water and eventually it will get there. Okay? That's the humectant property of coconut oil because of its triglycerides. It's an occlusive because you've heard me talk about the fatty acids are mostly medium chain. So, and they look like lugs. The fatty acids are flat because they're saturated. 92% are saturated. So you can imagine how it's an occlusive. And lastly, it contributes the fatty acids we talked about to the repair of the damaged cells. Those are the 3 important aspects of coconut oil. Plus the 4th one, it's microbial, and so whatever bugs may have been able to go in because of the changes in the microbiota from barrier, this repair is addressed.
There you go.
Don't let my mother talk about coconut oil.
She'll go
because-
on forever. But basically, yes. So I'm saying hi to folks on Instagram. I just decided to go on because why not? Because it's an open forum today. So we're taking questions. Most of our questions, obviously, so far are from Facebook because that's where we're going live. But I figured, why not? If you guys are there and have questions, let us know. There were several questions here from Jean, I think Faye, and another person asking about dry hair and dandruff. And the same stuff that we shared
Same thing.
earlier for
They apply.
falling hair, honestly, it's the same thing. So avoid the irritants, avoid the allergens in your hair care, shampoo, conditioner, and styling products because that can irritate the follicle and just make hair thin. Remember that stress management, this is the same for dandruff as well and dry hair. You want to manage the stress. Stress is linked to inflammation. Inflammation is not going to help you. And telogen effluvium is severe stress of the body, either from COVID, pregnancy, typhoid fever, what else did we say? Chemo,
Flu.
flu, and it's a temporary hair loss. And then there are other things for hair loss from pills and topical actives that are really effective to more procedures, right? Which you'd need to ask your dermatologist about.
Okay,
So-
just carrying on from what Laura has said. By the way, she's a great student, don't you agree? The dryness, the dandruff you're talking about, the scaliness is not the hair itself. Huh? There are two factors here. The hair itself gets dry, but the scalp is really the one whose barrier is compromised by the irritants or allergens that you may be using on that hair, whether it's in men, the waxes that they're using or the gels that they're using. The other thing is, so therefore that has to be addressed. The other thing I'd like to mention as well is that if you have relatively thin hair, whether it's a man or a woman, and you're sitting underneath a fluorescent lighting
Oh, right.
that shines on that, if you notice that the dryness or the irritancy of the scalp or the dandruff is much more there and hardly anything here in the back, you may have to consider a photoreactivity of the chemicals you've been using in the hair and therefore on the scalp skin that brings on the irritability and the allergenicity of the light from, let's say, the fragrance or the preservatives that are in that product. I see this quite often,
Okay.
right there.
The other thing to add here is a wonderful paper she shared in our live stream on hair, which is very recent, 2019, on the
Right.
use of coconut oil for the scalp for dandruff.
Yes.
Because dandruff can often be, make sure it is dandruff, right?
That's right, it's a
Dandruff can be
European
psoriasis,
product.
Exactly. But dandruff can also be because of an imbalance in the microbes on the scalp, and
That's
virgin
right.
coconut oil can really help with that. Jean is asking effective ways to manage aging skin to keep it healthy. All the stuff we said for dry skin. So again, avoid the irritants, the allergens, fragrance, preservatives, stuff like that. The coconut oil, right? Virgin coconut oil, because you want, look, that glow, that snap, as if naman I look at her. That glow, that snap, that vibrancy
I
is
like that.
from a healthy barrier, right? It snaps, it looks, it feels fantastic. It feels
You should feel my
fantastic.
skin, by the way. 82 years old, but I tell you.
Right.
Nice
So-
and soft.
So key things there are the VCO barrier repair sunscreen every single day, both indoors and
Sun and light
outdoors.
screen.
Absolutely. Like we're here. I'm looking at gadgets. I have whatever. I have 2 sunscreens on.
I really should start that
Plus
layering
concealer
article.
and bronzer, etc. So those are key for aging skin. If you also wanted to do active ingredients, the classic things are to look for a keratolytic, a micro exfoliant, something that does desquamation. Look at me with the big words. Basically,
I'll tell you the things that you can use. I'll tell you now the things that you have to remember that may be causing. Because remember, I tell you, diagnose first what's the cause. So, as you older, what happens? Drugs are being given to you. You're taking statins to bring down the cholesterol. You're taking a blood pressure medication to bring it down. You're taking medications to make you sleep at night. You're taking antidepressants because gall awful. You're taking painkiller. You're taking drugs for diabetes, etc. These drugs are photoallergens and allergens as well.
Right.
And they can be the cause for why your skin seems to be blotchy, seems to be irritable, seems to become reddish
Yeah.
and, break out. Why? It
Yeah.
may not be, going back to that first question today, it may not be the product you used 2 weeks ago, but a cumulative effect of the things that I've just mentioned.
So yeah, another thing I think to point out with aging skin, aging isn't, some people say aging is a disease. Aging is really a natural part of any biological.
Every day, including for the baby.
Yeah, it just, we're biological organisms, right? So we go through oxidation. That's just what it is. But to age in a way that you keep your skin's barrier intact, you feel healthy, you feel pep. I mean, look at her. Look at her. She's like, she had cancer 2 years ago. Even after swimming, making sure she kept herself fit, all of this is key to aging well, and it helps your skin too. Okay, so many questions. Alrighty. Milia, what causes them and how to avoid them? And can we just pinch it? No. And is it hereditary? Sorry, I love that because it's such an honest question.
Milia are just clogged pores.
They're
Uh,
actually fat, right?
They're fat, the lipids that you produce, and they clog up the pore. They produce little milia. That's one. They could also be lipids from chemicals that are on top of your skin. Let's say you're dry skin now because you're aged skin. And so therefore you decide, I'm going to slather on this moisturizer or night cream or whatever. That in fact may be comedogenic. That means it may be clogging up the pores, and therefore, bingo, you get milia. It could also be because of the aging skin itself. Because among the things that first appear as part of aging is the development of epidermal cells that do not function quite normally anymore. Part of aging, part of the oxidation process, part of the things that are making you age, whether it's from the things out there, the chemicals that you're exposed to, the gasoline fumes, the whatever that you face in the kitchen. All of those are part of the aging process. And milia can be an effect of that. And then those of you who are older may say, yes, and the next thing I know, I had little warts, tiny little warts.
Yeah.
And then, yes, I smiled and I would start noticing the little fine wrinkles. Those are already part of the aging process that may start quite early in life, actually. Look out for it. And if you begin to have milia, consider what you're applying and consider that you may be making your skin age faster because of the things that I had told you about are aging for the skin, whether from the lights
Okay,
indoor
but going
or out.
back to the milia, sorry, we have a helicopter. See, this comes free with sound effects. Just one last note on the milia. Don't self-diagnose. Milia can look like a bunch of things. Right? Someone
Yes.
might think it's keratosis pilaris. Someone might think it's whiteheads.
Correct. It could be an
Milia-
early basal cell carcinoma.
Good Lord, it could be an early basal cell carcinoma, so we want to rule that out. Don't self-diagnose milia. This is something I just want to underscore. We have a question on Instagram. When you're getting vaccinated, do you need to mention you have skin allergies or conditions?
You can mention them, but it doesn't necessarily mean you're going to react to them when present in the vaccine, by the way. And this has been shown in a number of studies.
it's someone actually, I think Jana from Utah also asked this a while back when we did our thing on COVID and skin. Anyway, I posted actually on dmvinskin.com a blog post that breaks down the ingredients of the more common vaccines that are out there. And really the studies have shown, because it's injected into the body and the bloodstream rather quickly, you don't tend to react, right? Even if your contact allergen is there. If, however, you have prick tested positive to something that is an ingredient in a vaccine, then that's really important to disclose, correct?
Right.
So do disclose it.
Remember
just to
that
be
the
safe.
chemicals that are similar to the things you are tested, whether by skin test or by a patch, are plastics in the sense that chemicals, and when they are applied, they then solidify. So that already is no longer an allergenic state. So presence may not necessarily mean that they're going to produce the allergy to you. And besides, number one, that's the ingredients. Number two, the way it interacts with all the other ingredients in that vaccine makes it different already by the time it gets injected into you. So what I always tell patients who are worried about the fact that they had allergies and I'm worried about getting a reaction, I'll say, well, you have two worries. Either you get COVID or you get a reaction. And I tell you the reaction we can take care of very quickly. COVID, that's another problem.
There you go. You heard it here, folks. Tammy, if I'm not mistaken, has a great question on what are filaments in the skin?
Filaments.
Filaments.
Are you talking pathologically or are you talking of things that are filamentous that are injected into the skin? There are filaments called threads. Are you talking of that? And these are,
Let's say yes to all.
let's do the threads first.
Okay.
Threads can be filamentous. And what the threads are they're like
Filamentous.
tiny little suture material that is used to suture the wound that your child had because he lacerated his knee when he fell. Okay? So those are suture materials. And what the threads are is that they are positioned in such a way that they can then draw that. I don't want filaments though. So, so they pull so that this one then becomes less joey, because is that the triangle where this one is wider and this one is narrower becomes inverted and we begin to have the jowls and the whatever. So that's one thread filament. Another filament I can think about is the
Little white thread things in skin.
little white threads.
Little
Maybe
white thread things in the skin.
that's probably what you're talking about,
Yeah.
is the threading that is one of the not so interventional procedures used to raise the laxity of the skin.
That's right. So instead of cutting here and pulling, these
Use
little
the
threads
thread.
are sort of put through, and then there's a slight pull there, so it's less invasive. But it's another, thing. Thomas on Instagram is asking, how often do you reapply sunscreen indoors?
Indoors, I think just applying it in the morning and then standard, just applying it in the morning and then reapplying it later in the afternoon, because most likely you're going to continue using your computer anyway until about midnight or later on into the evening. So you apply it in the morning, reapply it sometime in the afternoon. But if you're the kind of a person who's always touching his face, you may want to reapply it more often than that.
Yeah, also if you happen to be photosensitive, right, or photoallergic, you might, like here, this is a unique situation. I don't usually sit with a lamp right there, but I'm right next to a window. So I would reapply probably. Or if you really don't have time or you don't want to reapply, what you can do is layer. Like today I was mentioning I have a physical sunscreen on, sun and light screen on, and then a physical inorganic, like I mix them and I put that on top, and then I put like concealer and a bronzing powder. The layering really helps.
And remember about reading the labels.
Oh, I'm happy we helped with the alopecia.
The ingredients that are placed in sunscreens that are mainly for outdoor are really chemicals. What you want is a sunscreen that has those plus three terms: zinc oxide, titanium dioxide, and iron oxide. Look for products that contain those, and that will give you both outdoor sun and indoor light. I hardly go outdoors anymore. When I go swimming, I will. So I'll put on that sunscreen that is
you have to
for
reapply
outdoor.
every hour or two.
Right.
If you're outdoors.
Or immediately after I come out, I'll
The swimming,
reapply
yeah.
it. But the one for indoor is I use a product that has only zinc oxide and titanium dioxide. Then I layer, like Laura said, the iron oxide containing chemicals. So I'll use a foundation powder that has lots of iron oxide, and then I may use something to make me glow. You notice I glow. to make that skin glow. That has also iron oxide,
Yeah.
a little bit of blush, and so you layer.
Layer.
And this I done in a study that's really fantastic. I
We
did
have
it.
so many more questions.
Excuse me.
So I'm gonna try to get through them quickly. Tammy, so it could be the threading is what we're talking about, or this is why I was saying earlier for the person who asked about the Milia. Anything that's white and a bump, don't self-diagnose, because it can be so many different things.
Right.
It just is too difficult to maybe guess at, right?
From Milia to awart to
Yeah.
sebaceous hyperplasia to sebaceous cyst,
Exactly.
and most like, and in the end, an early
It's a
basal
lot.
cell carcinoma, which
So Jana is asking what causes seborrheic dermatitis inside the ear.
same thing that causes seborrheic dermatitis in the scalp, which is usually an association of the presence of oil together with a bug we call Pityrosporum.
Malassezia. Why did they change the name?
Because it sounds better.
Okay. So apparently it is also a microbial not imbalance, but a disruption of the microbiota of the ear. So VCO could be helpful there as well, right? I actually just put something with potassium azelloyl diglycinate and virgin coconut oil here because my seborrheic dermatitis was acting up here and it was flaking and red and painful. So that was this morning. Jana is also asking, oh no, sorry, we have Sheila on Instagram. I see brown spots appearing in my arms. Join the club, Sheila. Face, legs, and in my back. Oh, interesting. Could these be the result of my younger years exposing to the sun without sunscreen or something I should seriously worry about?
Both. You see, with sun exposure, studies have shown that it takes about roughly anywhere from 15 to 20 years before the effects of sun damage. Those are the original studies. Nowadays, a combination of sun plus all of these exposomes, is what we call in the environment that we now are exposed to in modern life, can shorten that time. So I mentioned earlier that the signs of your skin aging because of this combination of exposomes and the sun are the fine wrinkles, the little milia, the little warts that appear, and of course these things that you were mentioning, the little brown spots here and there on previously sun damaged and burnt skin when you were younger.
Right. They could also be post-inflammatory hyperpigmentation, Sheila.
Also.
So if you had acne or itching or a rash, or really anything there, when it goes, that can be a post-inflammatory hyperpigmentation, those dark spots. Melasma normally comes on the face, right? Not necessarily the body. And you mentioned the arms and the back. So I wonder if the arms, if it was an insect bite or some itching and stuff, that could be at play. But the answer to all of that is what she was saying. You really need to take care of the sunscreen issue and use it religiously every day.
Especially if they're discrete, almost uniform in size, they could be post-inflammatory from insect bites, from bug bites.
Yeah. Sheila, I want to ask, I can't see you, right, on Instagram, but if you happen to be, like, I'm a very pale biracial kid, right? So my skin is quite pale. But for browner skin tones, as we get deeper and deeper, our beautiful Filipina copper skin and darker skin tones, when you see a dark spot, pay attention to where it is. You mentioned arm, but if it's on the finger, right? Be
okay.
careful. Or on the toe, those kinds of things.
Or on the nail.
Or on the nail, because for people who aren't very white Caucasian Scandinavian skin tones, that can be an early marker of a potential skin cancer.
Right.
So just have it looked at.
So the little dark spots in relation to aging and the possibility of them becoming cancerous, is always there. As we grow older, you should therefore be more aware about them. When they become a little bit thicker or whatever, it should be seen by a dermatologist. They could be, again, early signs of lentigo is what we call them. Lentigo senilis is another one. And then from lentigo into...
There
There's
you
names
go.
for them.
Big, great words to remember today. Okay. All right. So, functional foodie. I will find you. I will answer that later. Okay, we talked about. Oh, this is a good one. Nathan on Facebook is asking, "What do you think about glutathione pills?"
Okay. Glutathione is one of the innate antioxidants we have in the body that's very powerful. Okay? And so because it is one of those preformed, or rather the body forms that glutathione inside the body, and it's one of the antioxidants that work in quenching what we are called the reactive oxygen species that are produced when there's oxidation.
Right.
Normally, the body produces enough of those to stimulate oxidation and then enough of the antioxidants to douse whatever reactive oxygen species is formed. But in this day of chronic stress, we may in fact have much more reactive oxygen species that needs to be quenched. And it's because of that, therefore, that oral or topical antioxidants like glutathione come out. The problem, however, with taking too much of a good thing
Yeah.
is that it can turn against you because the body produces antioxidants and preoxidants in just the amount
you
of
need a
that the
balance.
body. There's always a balance needed. When you instead take so much of vitamin A and C and D and any of these vitamins, the body is no longer in balance, and you may actually, studies have shown that taking so many of these multivitamins and all of that, including the antioxidants, is actually, in studies have shown they can either really work in one third, doesn't work at all, or in a few or a number, another third, these studies have shown that they actually worsen and may have developed more of the cardiovascular and obesity and cancer. So, going back
Glutathione,
then to
yeah.
glutathione, I am not a believer in it. I am a
There are
believer
no
more in
studies,
eating
really.
and the foods. And especially, we are totally against, we dermatologists who do the studies and have read the studies, are against IV glutathione, which is commonly used by a number of people who want to be
Yeah,
white.
no, it's pretty.
I don't know
it's,
why.
It's pretty dangerous. So be very careful about IV glutathione. The other thing to remember about supplements is that there are no studies right now specifically on glutathione as to how much you really need in a supplement. And then I haven't seen anything on how much of the actual active is in the supplement, which is one of the bigger concerns of supplements. And also how much actually gets to you versus like just gets eaten by your gastric juices and whatnot. So not so whatever. I want to mention Kin was able to see you in person. You're so nice and pleasant to talk to.
Oh, nice then. Hello there.
Kin. So CNC, to your earlier question, yes, it does. But also for acne, is it better to use the salicylic acid lotion instead of a monolaurin gel since it has salicylic acid, or can I use both products? Both is actually what I would normally recommend. And the nice thing about salicylic acid, I had mentioned earlier that salicylic acid is oil soluble, uniquely so. It's one of the few actives that does
Really
that,
is.
diba? Micro exfoliation.
Beta hydroxy acid.
Beta hydroxy acid in the middle, like in the deeper, oilier places of the pore.
It unclogs it.
So if you use that first and then the gel,
That'll be great.
it actually works
Again,
really well.
use it because salicylic acid is an irritant. It stings and all. Don't be too gung-ho and immediately slather it all over twice a day. I mean,
Follow the instructions.
follow instructions.
Okay, Tammy is adding here, I've been using the VCO, it's so much better. Water was fixed, that pH water problem. But it wasn't long after that when I was diagnosed with rosacea. Could that water have caused the rosacea?
The water was an irritant and produced dry skin. Rosacea tends to, over time, develop dry skin. You know, you're oily, right? And then rosacea begins to develop at the age of 35 or so, more into the 40s. So at about the same time, your skin will also begin to become dry and photosensitive. So the question is, did the water contribute to it? Possibly,
Yeah,
but
maybe not caused it.
not cause necessarily.
It could have aggravated it. Okay, folks, we have about 5 minutes, so I'm going to rifle through.
That was fast.
I know, because there's so many questions that are awesome. I want to make sure I get through.
I enjoy this so much.
Ram on Instagram is asking, how do monolaurin pellets work exactly, and what are the real benefits?
Okay,
Complete benefits.
I'll try to shorten it. Years ago in 1998, I think, Dr. Dairit here in the Philippines was the very first one who did a study on HIV, and he had 3 kinds of patients. There were very few patients actually. I think there were only 5 each. One group he gave the coconut oil. Another group he gave the monolaurin, and the third group I forgot what, or whether it was the control. I really don't remember right now. And they found out that finding with coconut oil as well as monolaurin, the equivalent dosage that would produce HIV turning, so that the immune cells were better already, and the bugs and all the laboratory tests were much better. They found out that it was 800 milligrams of monolaurin 3 times a day. So it's on that basis, therefore, that I have asked our pharmacy at the clinic I go to produce monolaurin pellets based on that. So I tell patients, if you take 1 capsule twice a day of this is equivalent to an everyday kind of a preventive antioxidant and antimicrobial. And if you've actually been exposed to somebody and you're worried, in addition to applying the coconut oil into the nose and mouth and gargle, I tell them to take 2 twice a day. And for those who are actually having COVID, to minimize and lessen the severity of their COVID infection, I tell them add on the 3 capsules 2 or 3
I'm going
times
to
a
jump
day.
in here because we have 2 minutes, 3 minutes, and I want to make sure we answer that like this. So first of all, vmvinskin.com, there's a study review of several of the studies of monolaurin, virgin
that's right.
coconut oil, and their derivatives since about the 60s. Monolaurin's primary thing is it's a very, very effective antimicrobial.
Broad spectrum.
Broad spectrum, so antibacterial, antiviral,
Viral,
including
antiprotozoal.
with coronaviruses, and antiprotozoal, antifungal. So it's used for a bunch of different things. Taken as the pellets, it's great as an anti-inflammatory, antimicrobial, all of those things. And I was going to add one more thing.
And it's
because
native to the skin, in that you grew up with it
it's
since you were
native to us.
native to the human
Yeah.
body. And so therefore people always ask, if it's so broad spectrum antimicrobial, what happens to my own microbiota? Do they get affected? And the answer is no, because it only recognizes, and there have been studies to show, it recognizes only
The bad
those
ones.
cell membranes that are not native to the body.
So monolaurin's also
There's
found
the word
naturally-
native.
Yeah,
Virginal?
found naturally in our breast milk.
You want to
So-
go back to virgin?
No, I don't want to go back to virgins, please. And I also cannot go back to virgins. I have 2 children, so that ship has sailed. Okay, I do have a question from Leah.
We
So-
can talk about
Wait. What can you say about oral sunblock?
the oral sunblocks are good, but they only give you a sunscreen effect of about 3 to 5 at the very most, and that's being generous. So they can be taken before you go playing golf, because this is usually what that company advertises their capsules for. I'm actually going to be doing a study on a plant, a botanical in the Philippines, because my feeling is that after all, right in the middle of the tropics, we may have plants that produce very good levels of natural antioxidants. We're going to be doing a study on that.
Okay, on that note, folks, I think I'm gonna have to let her go. As you can tell, this lady has 3 ongoing studies for virgin coconut oil and COVID. She has something else on psoriasis and an anti-inflammatory diet that I have to help her with.
God,
I
her
will
memory
help
is
you.
amazing. Sometimes I have to dig up with them.
So she's got a lot to do. So I will say goodbye.
Thank you again
thank
for
you so
listening in,
much.
Ken. It was nice to meet you.
Let us know if there's anything else that you guys want us to tackle next time. Otherwise, maybe we'll do open forums. Maybe we'll just do, I don't know, and stuff. Anyway, let us know in the comments. Contact us, and we'll, anyway, I love you. Mwah. Thank you. Okay.
Adios.
Bye.
Bye-bye.
Okay, folks, I will stay a little bit just to answer. It was Cianci who was asking me, does Skin Tangible have SPF? It really does. The thing is, in the United States, they have different regulations for sunscreen. So in the US, I think we don't put the claim, which is actually a detriment to us because, obviously we can't make this special claim. But it's there. So it is on the Philippine labels, other markets. Other than that, I think I've gotten everyone. So yeah, let us know. Please don't forget to follow us on Instagram and like us on Facebook and subscribe to our YouTube channel. And yeah, let us know if, I don't know, you want us to just do more or you want us specific questions or specific skin topics next time. But I will see you. Be safe for those in the Philippines. Stay out of those floods and take care, everybody. Bye-bye. And here.